All right, welcome to another 10-minute learning with Brandon, and we're going to be talking pretty much all things respiratory diseases, genetic stuff, all that kind of stuff. So today we're going to talk about sleep apnea, and this is a pretty common sleep disorder. There's different types, causes, symptoms, diagnosis, and treatment options. So we're just going to, again, kind of go over those things and see if we can learn a little bit more. So sleep apnea is a condition that's characterized by pauses in breathing during your sleep. And then we're going to discuss just the two main types. There's obstructive sleep apnea and central sleep apnea. So the obstructive one is related more to people that are obese, a little overweight, have bigger neck, and what happens is their airways close off, and it's up in the upper airway, so it kind of shuts down while you are sleeping, and you can't take a breath to be able to breathe at night, kind of a thing. So that's the obstructive sleep apnea. And then central sleep apnea is where it's more the brain is not telling your lungs to fire and take breaths. So you can have a combination, a mixture of both, but there's a lot of people that deal with OSA, obstructive sleep apnea. I haven't seen as many people with central sleep apnea, and there's just a couple of different ways that we would take care of those people and give them different treatment options. All right. So how does sleep apnea affect your body? So the mechanics behind the obstructive sleep apnea and central sleep apnea just kind of went over. And so we're going to examine how that kind of impacts the sleep apnea on like daytime functioning. So you're going to have a lot of symptoms kind of like sleepiness, irritability, cognitive repair. So if you kind of forgetful of things, just always tired even after you've woken up, you could have some obstructive sleep apnea going on. And so there's just this little diagram here talking kind of about insomnia and sleep-related problems. A lot of people are going to have a lot of these different disorders, if you will, because they have sleep apnea or central sleep apnea. So it just kind of, unfortunately, this round robin type of thing. You're tired, you can't sleep, tired, and you just never seem to get that fullness of rest or anything like that. And it can bleed into your day-to-day activities at work if you cognitively just can't seem to gather a lot of the thoughts that you need to have and being able to do those simple type of things. You might want to look into getting some help for this particular thing. All right, so some of the risk factors for sleep apnea is obesity. We kind of talked about that. Your age, gender kind of plays a little bit of role, genetics, lifestyle habits. So a lot of the common symptoms, and if someone listens to you while you're sleeping and all that kind of stuff, a lot of times they'll say snoring, but daytime sleepiness, breathing pauses. Some people will actually say that, hey, you paused in breathing X amount of time. I see it every once in a while in the hospital because we're able to monitor people 24/7. When you watch them fall asleep, you'll see them obstruct and not breathe, and they try to take breaths, but they have to overcome that obstruction to be able to take the breath in, which usually makes them have to wake up. And so there's not a very good circadian rhythm that happens for people, and that's why you're tired, is because you're pretty much holding your breath all night. And so you get some mood changes, and those are just kind of some of the potential signs of sleep apnea. So your risk of sleep apnea increases with age, weight, and if you're male, it's a little bit more common. And then for females, it's a little more common after menopause. So, all right. So diagnostics and screenings. So we're just the doctor's going to look through a few different things. So a health history, trying to get all the information of your health over a period of time. Some physical exams. Sometimes they'll measure your neck, see what your BMI is, your height and weight, and just a bunch of those. They can even do some blood tests as well to kind of help. If you're holding your breath all night, you'll normally have kind of a retained CO2 level in your blood, and so you kind of what's called a CO2 retainer. So you can look for that information with arterial blood gas, a venous blood gas. So just kind of recognizing the importance of seeking medical help through your doctor to be able to get evaluated for these things is always the best idea and best plan. So going in and seeing your doctor, telling them what your symptoms are and how you're feeling and all that kind of stuff will go a long way to be able to help you manage whatever health ailment you have. All right, so treatment options. So there's different modalities when it comes to obstructive sleep apnea. The main ones are CPAP and APAP. So CPAP's continuous positive airway pressure, and then APAP is it's an auto one. So the CPAP's just going to give 1 centimeter of water pressure all night, and you're just going to get like, say, 15 centimeters of water pressure, and then you're able to kind of breathe through that. And what it does is it helps stent open your airway in this area so that it doesn't collapse anymore. And so it keeps it stented open, makes it to where you're able to take your breaths, you're not interrupting your circadian rhythm while you're sleeping, and you're not holding your breath anymore. The cool thing about the auto one is that it will change that pressure, say from if you need it, it'll go up to 20 centimeters of water pressure, and then go back down to 15 if that's all you need, or go down to 10. So it kind of adjusts things so you're not getting just this constant pressure. It gives you what you need at that particular time. Excuse me. And then the other thing for the central sleep apnea, since that one is your brain is not firing to tell your diaphragm to take a breath, there's some electrical things that aren't working. The BiPAP actually has a rate that you can set. So you have a high pressure and a low pressure, and it's able to give you tidal volumes throughout the night. And because if you just had a CPAP machine with central sleep apnea, you wouldn't take a breath, and your airways would stay open, but you still wouldn't be able to blow off that CO2 and exchange the oxygen that you need. So again, going to your doctor and getting a personalized plan is going to be very helpful in your diagnostic and treatment options. So management strategies and resources. So really just being consistent in your treatment. A lot of people have a hard time staying consistent with it. So using your home CPAP machine, whatever it is that you've been prescribed by your doctor, is going to be paramount in you actually feeling better and doing better. And making sure you follow up on your appointments, talking to your doctor, getting the feedback that you need and all that kind of stuff as well. There's some lifestyle choices that you can make. We talked about how obesity is the big reason for people needing to have a CPAP, and stuff that I was reading, it was saying if you could just lose 10% of what your body weight is, if you are obese or morbidly obese, it will go a long way in helping you not have to have, all of these different things to be able to sleep better and everything like that. So losing weight definitely can help out and save your life, really. So it helps you from not holding your breath all night throughout the night and being woken up constantly. So again, having open communication with your healthcare provider is going to be paramount. It's going to be very influential for you to be able to make better decisions in the future and help yourself feel better overall and have a long-term success. Okay, so just concluding that there's some practical tips that we talked about for you if you have to live with sleep apnea. So again, holding on to those treatment plans and holding true to those. Have good sleep hygiene. So if you're using these breathing devices, so like a CPAP and everything like that, you need to regularly clean that device. So if you think about it, you're going to have humidity and some water that goes into your airways, because you want, if you've slept with your mouth open all night, you usually get pretty dry. It's really uncomfortable and you have a hard time breathing and everything. So if you don't have humidity and heat, water to be able to kind of keep your airways moist, then you're going to cause problems. But again, you can introduce infections if you're not cleaning your equipment correctly. So following the manufacturer recommendations on those, getting things replaced when you need to. They can only last so long because the mask or the nasal pillows, whatever you end up having, they're soft and they're designed to help not cause breakdown on your nose, on your skin and everything like that. But so you would have to upkeep getting new items and replacing hoses and everything like that. So if you have questions about that, definitely ask your healthcare provider and or the durable home equipment provider that you're using to get your CPAP or BiPAP machine from, and they'll have cleaning things for you, how often you need to do it, how often you need to change your mask, your hoses, and all that kind of stuff. And just want to keep it clean, just like everything else, right? We kind of using the thing with the dentist, if you need to clean your teeth, you need to do that quite often, brushing your teeth and everything like that. So it's kind of the same idea. Bacteria can grow pretty much on anything that's warm and wet. So you need to take extra precautions for that. All right. So again, I got all my information from this website, the American Lung Association. So definitely check that out if you have any questions about this. There's a lot more information there, and also any other diseases or treatment options for those diseases for lungs and kind of some heart stuff. So, but thank you again for another 10-minute learning with Brandon, and we will talk to you later.